Ever have or hear about a person who has just fallen down and broken a hip or a back or the wrist for that matter, or just a cough or a sneeze can break your bones? If yes, then we may be dealing with something we call osteoporosis. So osteo and porosis. The etymology comes from two words, osteo and porosis. Basically, osteo means bones and porosis means they are porous, so brittle or weak bones. We ask ourselves, what is osteoporosis? Why does it happen? How does it happen? And how to prevent it? Our bones throughout our life are in a constant state of balance between making and breaking, making and breaking. Any imbalance between the two states results into either our bones being too strong or too weak. Our bones are the strongest when we are between the age of 25 and 30. Risk factors for having osteoporosis is there are some factors which are modifiable and there are some factors which are non-modifiable. So modifiable factors, our gender. So females are much more higher risk and for osteoporosis. So females are at much more higher risk to have osteoporosis than males. The other thing is age. The more we grow, the growing capacity of the bone cells becomes weak and becomes slower. There are also some medicines, for example, long-term use of steroid injections or steroid tablets, using them for long terms of medicine or medicines for epilepsy that can cause or increase risk of osteoporosis. The other modifiable factors include our diet, so inappropriate or imbalanced diet or diet in lack of calcium or vitamin D. So calcium, for example, is found in dairy products. Low-fat dairy products are recommended, and dark green leafy vegetables. These are also high in calcium and vitamin D. The other factor for osteoporosis, the other risk factor for osteoporosis is lack of exercise or sedentary lifestyle. As we know that the less you use your muscles, and so the weaker they become. So the more we use, even the bones become stronger. So disuse osteoporosis for those who do not make use of the muscle. The other question now comes, how do we prevent it? So let's look at the risk factors and those factors which are modifiable, we modify them. So for example, eating a healthy diet, high in calcium and vitamin D, exercising is extremely important, not only for the body, not only for the heart, not only for the kidneys, but also for the bones and muscles in general. So the World Health Organization recommends at least 3 hours a week of exercise, which may include swimming, cycling. Simply walking is also good enough. So make sure we all exercise and make our bones stronger. So now we know what osteoporosis is, who gets it, and how to prevent it. We have to make sure, and we all know that prevention is better than cure. So I wish you healthy bones.